There are three main causes why we get skin cancer, two of which we have no control over. First is your skin type. The lighter, the fairer your skin, the more you tend to sunburn rather than suntan, the more likely you are to get skin cancer. This is genetic. You inherit this from your parents. They give you many other wonderful characteristics if you happen to be very fair and prone to skin cancer, so don't blame them for your fair skin. Second is your age. The older we get, the more skin cancer we get. We have no control over that either. The third factor is how much sun we get. That is the one factor in the causation of skin cancer we can do something about. We can avoid sun in the middle of the day when the sun is most intense. We can always use sunscreens, hats, sun protective clothing to reduce the amount of ultraviolet light that our skin gets to reduce our chance of skin cancer. We also should always avoid going to tanning booths because that increases the risk of skin cancer as well. We're very fortunate to live in a beautiful area with so many wonderful outdoor activities. And I don't expect any of you to become a hermit and never go outside. So what I would suggest is protect yourself when you're outside. Try to avoid sun as much as you can. Between 11 and 3, do your outdoor activities early and late if possible. And when you're outside, use a good sunscreen, preferably one with zinc oxide in it, long sleeves, and or sun protective clothing. You now can get clothing that has sun protection in the material. It gives you lots of protection from the sun. Actinic keratoses are precancerous spots. These start as tan, pink, red, scaly, rough, often sensitive spots that will occur on sun-exposed areas. These lesions, if left alone and untreated, have the potential to develop into what's called a squamous cell carcinoma, which is a skin cancer that have to be surgically removed. So people who have actinic keratoses will get those treated with liquid nitrogen or a variety of different creams, or even a procedure called photodynamic therapy that we do here in the office. But this is the first marker of someone who's had too much sun. The first thing we usually see. And what patients often will come in with is just they have these little rough, sensitive spots on their face that don't go away. So if a rough, scaly spot is persisting and not going away, please get it checked. The most common type of skin cancer is the basal cell carcinoma. A basal cell carcinoma occurs in a variety of different types. It's usually a localized growth on the skin. It doesn't spread. Cure rates are extremely high with surgery, sometimes with radiation. And it's important to make an early diagnosis and get the treatment as soon as possible. Once you've had one basal cell carcinoma, you are at a greater risk of developing future basal cell carcinomas, so you need to have regular follow-up. Now let's review the different types of basal cell carcinoma. The first type is a superficial basal cell carcinoma. This type most commonly occurs on the trunk, but it can occur anywhere. It normally will look like a red scaly patch that just doesn't go away. So once again, if something is persisting and growing, it may occasionally get a little crust or scab on it or bleed. This would be something you'd want to get checked. The next type of basal cell carcinoma is the nodular basal cell carcinoma. These present as red, pearly bumps and nodules. Often they scab and bleed. It may present as a non-healing sore, and these can occur anywhere in the body. Most commonly, nodular basal cells will occur on the face, and treatment is with surgery with very, very high cure rates. The next type of basal cell carcinoma is the pigmented basal cell carcinoma. This tends to, is a basal cell that has pigment in it, and usually will occur in people who have more natural pigmentation. It's less common because people with more pigment, again, have a lower risk of skin cancer. And when they get skin cancer, often because they can generate a lot of pigment normally and naturally, they'll tend to have more pigment in their skin cancers. The last type of basal cell carcinoma is the morphic or sclerosing basal cell carcinoma. This type presents like a scar. It's a non-healing wound that's very thick, firm, and this is the most aggressive type, and this type is the type that we would always refer someone for a specific type of surgery called Mohs surgery. Keratoacanthomas are a common type of skin cancer that presents in a fast-growing nodule and of short duration, resembling a volcano, a red nodule with a little dry little crusted crater in the center. And often they're very tender. The history is it's been there 3, 4, 5, 6 weeks, growing very rapidly. These are easily removed surgically and can easily be cured. The squamous cell carcinoma is another type of skin cancer. This is definitely, again, related to sun exposure. It may evolve from an actinic keratosis, and these tend to present more as red nodules, often that bleed, sores that don't heal, larger lesions. They can be anywhere on the body. These require surgery. They may sometimes be treated with radiation, but almost always they're treated surgically, very high cure rates. There are certain situations in which a squamous cell carcinoma may occur in a scar, in an area where someone's had radiation treatment, on a mucous membrane where they can be more aggressive and need to be watched more carefully. And the surgery often needs to be a little bit more aggressive. The most serious type of skin cancer is malignant melanoma. And I want to review with you the warning signs of melanoma. Fortunately, it's just like the alphabet, A, B, C, D, E. A stands for asymmetry. So any pigmented spot that is, when you divide it in half, the two sides don't look the same, that would mean it's be asymmetrical. It could be asymmetrical because it has an irregular border. It could be asymmetrical because it has a variation in its color. That's the most worrisome sign that someone could have a melanoma. B stands for border irregularity. Most normal moles have a fairly sharp, well-defined regular border. Melanomas will often have a jagged, notched, or irregular border, or a fuzzy, indistinct border. C stands for color variation. Most moles are normally one shade or two shades of brown. They don't have multiple shades of brown. They don't have red, white, blue, or black in them. So if a mole or pigmented spot has multiple shades, that's another worrisome feature. D stands for diameter. So most normal moles are smaller than a pencil eraser. Bigger moles than that can still be normal, but melanomas usually will be larger than a pencil eraser. And E stands for evolving or changing. So any mole that changes or especially itches, those are the warning signs in a mole that you need to get checked. So asymmetry, border irregularity, color variation, diameter, and change or itching in a mole. These are all the warning signs. Anything ever exhibits any of these, you definitely want to get it checked, because melanoma is one type of skin cancer that can metastasize, which means it can spread to other distant parts of your body from your skin and potentially can be fatal. So now let's review the different types of malignant melanoma. The first is the superficial spreading malignant melanoma. This type usually will start like a freckle, a brown spot, or a mole that spreads outward in different directions at different rates. Say it's kind of like an amoeba, if you remember from biology. It kind of grows out in different directions, and that's why it gets asymmetrical. Different areas produce different amounts of pigment. That's why it gets the variation in the color. And as you can see in these pictures of melanoma, the irregular border, the asymmetry, the variations in the lesions. This type of melanoma stays flat on the surface for a certain period of time, during which removal gives you 100% complete cure. This type of melanoma can then develop a little bump or nodule in it, invade down into the skin, at which point the cure rate becomes less than 100%. So you want to find these lesions when they're flat like a freckle. The nodular melanoma tends to grow faster and deeper and is more aggressive, and the prognosis with this type of melanoma is not as good because it grows down into the skin much faster. It'll normally present as a dark nodule, often with bleeding. Sometimes it can be a red nodule and not have pigment. The next type of melanoma is called a lentigo-malignant melanoma. These tend to be the most slow-growing of all types of melanoma. They tend to occur in older people in sun-exposed areas, and they can be present for 10, 20 years before they become invasive. And it will start looking like one of your old typical liver spots, but that is continuing to grow and change and develop some asymmetry in multiple colors before it develops a nodule. Acrolentigenous melanoma is the least common type of melanoma. Often it's the one with the worst prognosis because it's diagnosed later, because acrolentigenous refers to the hands, the feet, and under the nails. So they tend to not be diagnosed as early because they're harder to see or often misdiagnosed. So if you have anything that's pigmented or changing on your hands, your feet, or under the nails, it would be a good idea to get it checked. The most important thing with a melanoma is getting an early diagnosis so you can get surgical removal of the melanoma as soon as possible, because the prognosis is based on the thickness of the tumor, and that's measured on the removed tissue by the pathologist under the microscope. The thinner the melanoma, the earlier the melanoma, the better the prognosis. The thicker the melanoma, the later it's diagnosed and removed, the worse the prognosis. So again, if any pigmented lesion is changing, is asymmetrical, has a variation in its color, has an irregular border, please get it checked.